Allie, who is a surgical candidate from a physiologic standpoint in how they're functioning?
So somebody who can be physically active, who can go up 2 flights of stairs without kind of missing a beat, somebody who doesn't have to wait at the landing between those 2 flights of stairs, somebody who can easily walk around the block a couple of times. Those are just the questions that I ask people before I see any pulmonary function tests. Then, of course, the actual numeric values of your pulmonary function tests allow your surgeon to understand what will it look like for you in the after we remove some of your lung setting. And we do a pretty good job of estimating, oh, we're going to take out this amount of lung and this is what you're going to be left with. Now, in your specific situation, I've definitely operated on patients like you before, and I'm going to put some fancy schmancy medical terms attached to your trash lung. So I think you probably had some degree of a post-obstructive pneumonia where the cancer grows really close to the airway, or at least there's just so much tissue around the airway that it gets clogged. And then there's basically not only cancer helping obstruct or clog the airway, but then all of the normal mucus within your lung gets stuck back there too. And when the lung gets clogged, it just becomes from like a nice fluffy sponge to something that's very boggy and wet and doesn't inflate. And so for you, that part of your lung wasn't doing any gas exchange like a normal lung does. And so I'm sure that your surgeon who saw you and evaluated you said, well, this isn't really going to change your pulmonary function at all in a negative way. In fact, like he said, or she said, it might even make you feel better in the long term once you acutely heal from this surgery.
We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.